Hey everyone, this is just a quick overview of what postural orthostatic tachycardia syndrome is. Some people refer to it as POTS, what it is, certain treatments that people use, some statistics about it, and information about a new clinic opening. So what we're going to cover is a little bit of the history around POTS, the definition of POTS, what a syndrome is versus a disease, the statistics around POTS, common symptoms that people see with POTS, lifestyle modifications that you can do to improve your quality of life, medications that are commonly prescribed, triggers for POTS, as well as references to the studies that are used in this presentation. So the history of POTS, in 1876, Dr. DaCosta studied 300 soldiers who complained of chest pain, an irregular rapid pulse, irregular heartbeats, difficulty breathing, tunnel vision, fatigue, and weakness, bad dreams, difficulty sleeping, headaches, and more, and coined this collection of symptoms irritable heart syndrome. And then in 1919, Thomas Lewis coined the term effort syndrome and soldier's heart and published a book after the Great War based off experiences at the military heart hospital. He described this syndrome in his book as, quote, when a healthy man takes exercise and this exercise is sufficiently stressful or prolonged, he becomes aware at the time of the effort or after it has ceased of certain symptoms, and he presents certain physical signs. The most notable of his symptoms is breathlessness. During the exercise, consciousness of the heartbeat may appear, giddiness, faintness, or fatigue may be added. And then in 1940, Dr. Lowe began working at the Mayo Clinic and did the pioneering work of what we know now as POTS. And not until 1993 did Dr. Lowe and the team of researchers at the Mayo Clinic create the term POTS. And in the 2000s, with ongoing research in POTS and well-known famous people such as Halsey, Katie Ledecky, Tori Files, and Christina Applegate, coming out and talking about their diagnosis of POTS has created more recognition around the syndrome and the need for more research. So textbook definition of POTS is a sustained heart rate increase of 30 beats per minute or a heart rate over 120 within the first 10 minutes of standing with correlating orthostatic symptoms without a significant change in blood pressure. And then for children and adolescents, it's an increase of 40 beats per minute. POTS is ultimately an autonomic nervous system disorder that affects the entire body and can manifest differently from patient to patient. So I just want to go quickly over what a syndrome is versus what a disease. POTS is a syndrome, which is a group of symptoms that tend to occur together. Not all symptoms need to be present for a patient to be considered for a syndrome. And then a disease is ultimately a medical condition with a clear cause. It is a pathological process that can be seen or measured. Some statistics about POTS. Most patients are typically between the age of 14 and 50 of childbearing age, average age of around 30 at diagnosis, and it affects an estimated 1 to 3 million people in the United States, and the ratio of female to male is about 5 to 1, so it affects more women than men. Symptoms can be broad, and you can have some or all of these. Neurologically, you can have lightheadedness, fainting, migraines, tremulousness, sleep disturbances, cognitive impairment, brain fog. Cardiovascularly, high heart rate, palpitations, chest pain, hypovolemia, pre-syncope, and rarely syncope, that's fainting. Skin, you can have red feet, flushing, cold feet, purple feet. Psychologically, you can have depression, anxiety, gastrointestinal issues, nausea, bloating, constipation, diarrhea, vomiting, abdominal pain, gastroparesis. You can have fatigue, myofascial pain, coat hanger pain, which is like your upper back area, dry mouth, dry eyes, urinary frequency, pain in hypermobile joints, fatigue, and other symptoms. As I said before, sometimes people will have some of these and then they'll transition to other symptoms. Sometimes they'll have a lot, sometimes they'll have a little, it just depends. So lifestyle modifications for patients with POTS, we want to see a fluid intake of 3 to 4 liters per day or more if they can tolerate it, a salt intake of 3 to 10 grams per day, compression stockings, waist height or above is best, 30 to 40 millimeters of mercury compression. Avoiding alcohol because it can make you dehydrated and make your symptoms worse. Raising the head of the bed. Recumbent exercises with increased intensity over a long period of time will help symptoms improve. A healthy diet, small meals frequently, high protein, and then some people find benefit in therapy like psychotherapy. Medications that are used, there's no FDA-approved medication specifically treating POTS. This is just a list of medications that have been used to help treat the symptoms of POTS. I'll make another video specifically about the medications and what the studies have shown for each in the treatment of POTS. Triggers of POTS, like what the initial incidence of POTS can be, includes viral illness, surgery, traumatic event, pregnancy, puberty. Aggravating factors, things that can make it worse, include exercise, food, alcohol, heat exposure, prolonged standing, dehydration, caffeine, menstruation, stress, and many other factors as well. I list my references here. I think it's important that people list their references as there's a lot of misinformation on the internet. And if you want to look up more information about these trials, here they are. I think the research around POTS is few and far between, but we're seeing more and more. And I think it's important to stay up to date on the new studies that are coming out. And then to stay in touch, we're opening a POTS clinic this fall in 2025. If you'd like to be added to the email list, it's kate@thepotswellnessclinic.com. We'll send you an email about when we're opening and more to come.